Welcome, welcome. Today we have with us Kelly Wilson. She's the Director of Patient Care Services here at Applegate Homecare Hospice. And today we're going to be taking a deep dive into home health, specifically these 4 different questions. What it is, who it's for, who's a part of the team and what are their roles, and then lastly, how is it paid for? So thanks for being with us, Kelly.
Thank you.
Perfect. So we'll go with that first question. What is home health?
So home health is a service that is provided in the home for patients that are either recovering from an illness, patients that may have an illness but struggling to manage their illness and get a little weak and are having a hard time managing their medications. It's very taxing for them to get out of the home. They're at risk for a fall. There's a few areas that we look at home health for, and getting the home health team in and getting the patient back to baseline and on their feet to prevent a hospitalization.
Perfect. And who's home health for?
Home health is for our senior population. Like I said, a lot of people that are struggling maybe with heart failure, pulmonary issues, coming out of the hospital, have had a hospitalization, and they're coming out with some home health. Some people need IV infusions, PICC lines taken care of, plus physical therapy. And then of course, people that are having surgery for total joint replacement. They're also utilizing home health quite a bit, having the therapist go into the home and do therapy with the patient for the first couple weeks after surgery.
Perfect. And who's a part of that team for the home health, and what are their roles?
So typically you'll have a nurse, and the nurse does the home health admit, and the nurse is, really there overseeing, making sure that the patient's vitals are doing well. If there's somebody needing infusions, they're managing that. If someone's needing medication management, the nurse is obviously managing that. And then we have our physical therapist, and the physical therapist is there to do physical therapy, create a care plan for the patient with goals, and working with the patient to achieve those goals on the care plan, as well as occupational therapy. Oftentimes, patients will be coming out of the hospital and they've been sick and they're going home, and occupational therapy is helping them get back in their environment, moving around their kitchen safely, showering safely. If there's any adaptive equipment needed, they're making those recommendations and, getting that adaptive equipment in the home. And then we have a CNA, and a lot of times if our senior population, if they're alone, then it's nice to have a CNA go in and help them with those showers so that once again, they're getting showered safely. And then our speech therapy is for patients that may have had a stroke, and if there's swallowing issues, then the speech therapist is working on that. A lot of times some cognitive issues and impairments, so that's typically our home health team. There are times with home health, if we're doing a home health palliative, then we do have a social worker in there and helping with emotional support and also navigating through outside community resources outside of what the home health provides.
Awesome. And with all those resources and all those parts of the team, how is all this paid for?
So Medicare, along with most insurances and Medicaid, pays for this. Typically at 100%. And Medicare actually likes for physicians to utilize home health when they can see a patient's not doing so well, maybe on a physical or just going in because they're not feeling well. They really like to see the physician getting home health involved, because a lot of times we can really reduce hospitalizations and those ER visits. And so they, it's a program they put together and they fund it. And so, yeah, it's 100% covered. It's great.
That's awesome. And where can somebody go to learn more?
You can actually Google online, or you can talk to your physician, your provider about home health. If you and your provider feel like this is a good option for you at the time, then you can talk to your doctor. And also people that may be in the hospital and they're making, getting ready to make their discharge plans, can also ask the discharge planner at that time if they feel that they're appropriate for home health going home, which in most cases they are.
Perfect. Well, thank you so much, Kelly.
Thank you.